Okay, now as Finance Minister Enoch Godongwana prepares to deliver the medium-term budget policy statement on Wednesday, expectations continue to emerge from individuals and diverse groups of organizations. DKMS Africa, an organization that's dedicated to assisting South Africans diagnosed with blood cancer and other disorders, has its own expectations. Its head of community engagement and communications, Palesa Mokomele, joins us now live to tell us about what they expect will come out from Minister Godongwana's medium-term budget speech on Wednesday. Palesa, good afternoon. Welcome to today. Well, the medium-term budget, as we know, it's about the mid-year between February, 1 year, February next year, and is also setting the government's priorities for the medium term, plus minus 3 years that is coming. So what are you hoping you'll get to hear he will say about the health sector?
So as an organization that works with patients who are diagnosed with blood cancer and blood disorders, and for whom there's already underspending, or rather no spending at all, or very limited rather, we hope that the prospects will look better in terms of patients accessing transplantations, which will save their lives. We are one of the smaller groups in terms of priority, and therefore we hope that we get an opportunity at least to get patients who are in hospitals, who are in oncology centers across the country, to get the treatment that they need, which is a stem cell transplant.
Yeah, I mean, the government has indicated that there's going to be more money that's going to be needed, and that you can't really get from taxes. They might have to borrow more money, therefore expose the government to more debt. Do you think they have to get even more debt in order to meet with your expectations?
Well, it's a difficult one because South Africa has so many other pressing priorities. We obviously don't want too much debt for the country, but in our case, we work with patients whose illnesses affect their entire families. They affect their ability to get work, and therefore to look after themselves, to look after their children. And what's the price for health? You know, each person wants their loved ones to be healthy and to get the best treatment that they can get. And as DKMS, we say that if we can get patients a stem cell transplant, and if DKMS and government can hold hands and find the money somewhere, that would be great for our patients. But I think there's no price to pay for health. So it's a very difficult one for us in this sector.
Yeah, because one of the mandate, so to speak, of government is to protect vulnerable South Africans, and they may be vulnerable due to a number of factors like poverty and ill health, and the people that you represent, people who need stem cells, people who've got blood cancers and other disorders, are also vulnerable South Africans, so there should hopefully be something for them. But in your view, what would that look like? Is it a quantum? Is it a commitment? As you correctly said, Palesa, there's a lot of competing priorities.
So firstly, currently as it stands, government doesn't fund unrelated stem cell donors. And this is where DKMS comes in. So if a patient who has a 30% chance actually of finding a stem cell donor within their family is unable to find one, then we need to look elsewhere. We need to look internationally, we need to look locally as well. 70% of our patients find a stem cell donor from a complete stranger. But as the situation stands right now, if you are in the state and you're completely reliant on the public healthcare system, and you find a match, a 10 out of 10 match, then you are in many chances not able to access the 70%. So we would be looking for something quite drastic, in the sense that if we find a donor as an organization, then the state can pay towards that transplant. That would be amazing. But perhaps that's not possible, but we are looking at something that at least allows families that extra bit of hope, where they're able to, where patients who have found a match but need that extra bit of help from government, then we're expecting that they would receive the help that they need, because it's already so difficult to find a stem cell donor. So if one has been found, then why not give that patient a second chance at life?
Yeah, and just a final question to you, Palesa. The medium-term budget also opens the door, or it's an opportunity for organizations like yourselves and other South Africans to engage with the budget, to lobby, and ahead of February, when the new budget will be announced. Will you use this period, depending what the minister says on Wednesday, to lobby and advocate for what you've just positioned to us here on eNCA going forward? Perhaps, if not this time, it might be included in the next budget.
So as individual organizations working within the blood space, and particularly within blood cancers and disorders, we have made submissions and are in contact with the relevant government bodies. I think that I know that the Department of Health is quite passionate about the plight of patients who are suffering from blood cancers, and therefore we see a very strategic stakeholder and partner there. But really, to amplify the message about the need for us to hold hands, especially as the cancer community, for cancer patients, to create a strong network for cancer patients, particularly older adult cancer patients, to get the care that they need, both medically and socially, is a long road. So we need to work together and to put submissions that are perhaps even more comprehensive and not just about finances. We need to engage social development. We need to engage a lot of agencies and government departments in order to create a strong support system for cancer patients in South Africa.
Yeah. How big is the need as we conclude, Palesa? You mentioned that there's a shortage.
The need is quite big. Statistically speaking, if South Africa has, every 72 minutes rather, a South African is diagnosed with a blood cancer and a blood disorder. So, but the problem is you don't see a face. So the problem is quite big. There is very limited access to, firstly, medication, and also to stem cell donors, who are also a means for people to get a second chance at life. So DKMS really goes out of our way. We go out of our way for patients to get a matching donor, and to create the education and the awareness for families, for patients, for donors to come forward and to register to give life-saving treatments to patients who need a life-saving lifeline.
Thank you very much, Palesa Mokomele, Head of Engagement and Communications at DKMS Africa. They, of course, advocate and look after and try and raise donors for people who suffer from blood cancers in South Africa. That's the expectations from what they hope Enoch Godongwana, the Minister of Finance, will say come Wednesday when he delivers the medium-term budget speech in Parliament.